Hi, do you suffer with knee pain? I'm Dr. Jason Tripp. I'm a chiropractor and a naturopath right here in Hermitage, and I help people to stop suffering with knee pain. So if you have knee pain, I want you to listen to everything we're going to go over. I'm going to teach you how to stop your knee pain. When we're talking about knee pain, one of the things that I've been able to do is I've been able to help people with their knee pain so they can enjoy life again. You know, and the purpose of enjoying life is so that we can walk, so we can get out and enjoy the quality life that we really want. But more importantly, I think, is to spend time with family, kids, grandkids, to be able to be with family on family functions or family vacations, to be able to walk during Disney while you're taking your grandchildren. Like, that's really the reason most of us will put in the time and effort needed to really make a change in your knees. So when we're looking at how knee pain develops and how knee pain gets better, you have to understand that you got to fix the cause of your problem. And so when we do our exam, we look at the cause of the problem. The reason I started doing all of this was because I had a knee injury several years ago. And when I had this knee injury, I had gone skiing with my son, and I was skiing down the hill. He was lagging behind a little bit, and I turned the skis to stop and wait for him. And the ski went into the snow, but my body kept twisting. And so that twisting motion hurt my knee. That was the end of the day for us, and I had a lot of rehab to do afterwards. But I knew I wanted to do the rehab through all three phases of healing so that I didn't have any permanent injury related to that. What do I mean by that? Well, if your body goes through three phases of healing. If you follow the principles of healing and do the proper therapy at the proper time, you can rehab the joint, you can make it better, and you can heal. That way you don't have future problems, future damage, future permanency even. But if it heals wrong, then it can go permanent. I knew I didn't want that, so I started right away getting into doing the rehab for the therapies. So first I'll go over the three phases of healing. By the way, you can find these on Wikipedia if you look under wound healing on Wikipedia. And what you're going to see is that when you look on there, it says there's three phases. Number one is inflammation phase. Number two is repair phase. Number three is remodel phase. Now, just to explain a little bit about how those work, the inflammation phase is when your body is putting in inflammation, extra blood supply, putting in macrophages to break down the joint damage that was taking place. That increased blood supply is why we get the inflammation we do. When we have that inflammation, it's heat, redness, swelling, pain, and lack of function. Well, when you get that, you're in inflammation phase. The goal of care should be whatever therapy is going to bring down that inflammation. And so that's what I started with when I injured my knee. And so I started with the therapies that bring down inflammation and pain to make that happen the quickest. Now, that's not going to be a long period of time. Within a few days, you start to bring down some of that pain. Many people make the mistake of stopping their care when they feel better, because there's actually two more phases that you have to go through if you're going to improve your knee and not have it go permanent and end up needing knee surgery or knee replacement or those kind of things. So you have to finish going through the knee the healing process. And so your body is going to go through what's called repair phase. When you're in repair phase, there's four things that happen. Your body, first of all, will put in scar tissue. That's the healing tissue of the body. And so when it puts it in there, the nerves become more sensitive to pain. So it's easier to feel pain when you have that scar tissue in there. That's during the repair phase. That happens for about 90 days. And when your body's putting in that scar tissue, it also makes the nerves tangled inside of the scar tissue as it's being put in. So the nerves get caught in there, and when you move, that movement starts to hurt that nerve again. And so again, it's easier chance of having it be painful. So when we're looking at those first two phases, the two more things actually do happen when the body puts in scar tissue. And what will happen is it'll also be weaker tissue. So the scar tissue is weaker by about 30%. So it's 70% as strong as normal tissue. And it's 70% as mobile. In other words, it's contracted, it's tight. And so as I was going through my therapy, I knew in inflammation phase, I just wanted to get the pain down. So I did a lot of stuff for that right away, whether it be icing, electric muscle stim. I even got my knee adjusted, those kind of things to help bring down that inflammation. But then when I went into that second phase, which we're calling repair phase, just like they do on Wikipedia when you can look it up, that nerve sensitivity, you have to do electric muscle stim. And what that is a mild current that feels like a gentle massage that decreases the pain and inflammation and therefore decreasing the nerve sensitivity. So it's less likely I'm going to feel that pain. If the nerve heals wrong with increased nerve sensitivity, that's when it starts to go permanent to some degree, which meant for the rest of my life I would end up having knee pain. I didn't want that. So I was going to do whatever it took to make sure that I did the right therapies. Also, nerve entanglement, when the nerve gets tangled, the therapy to do for that is the chiropractic adjustment to the knee joint. So when I had twisted, when I went to make that fall, when I was skiing, what we noticed was that the knee joint itself twisted and it was out of line. Now, when you have nerves that get entangled in the scar tissue because it's out of line, think of it like throwing a mop on the ground. All the fibers go in kind of crazy like this. They're all crooked. Well, when you take the mop and straighten it out, all of them go back to their normal straightening. Well, it's the same way with scar tissue. Scar tissue is put in like this, crooked, and the adjustment actually straightens it out. Now that does two things, but the primary one we're talking about is it'll decrease the nerve entanglement. And when it decreases the entanglement, I have less likely that I'm going to feel pain. And I really wanted to be able to get that motion back and not have it go permanent. However, if it heals wrong with increased nerve entanglement, then it can go permanent to some degree, where I'd have pain off and on the rest of my life to some degree, meaning that I could be standing or walking or moving and just barely twist wrong and have it be painful again. And I knew I didn't want that. I didn't want permanency, and I didn't want to have it just easily get injured or hurt just walking up and down stairs. So I said, okay, I want to do the therapy right in repair phase. Getting through the nerve entanglement, getting through the nerve sensitivity. After I got through that phase, I realized that I wasn't as strong as I used to be. I had some weakness still, and I wasn't as mobile. The scar tissue was too tight and it was weaker. So I said, how do I fix that tissue? Well, what we realized is the strength of the scar tissue had to do with alignment of the fibers. If it's crooked like this, then it was weaker. But when you straighten those fibers out, it becomes strong again. And so continuing with the chiropractic adjustments to the knee joint actually strengthen the knee because you're actually working the scar tissue. And that's one of the reasons why it helps. So the first reason for pain was related to working on that, decreasing entanglement. But as we do this, we continue that process, we build strength in the scar tissue. The mobility, the scar tissue is more tight, more taut, less mobile, not as stretchy than regular tissue. And I knew I didn't want to have it to where I had limitation in my joints. I can only bend so far and that's it. That's all I get. I didn't want that. So I started doing knee tractioning. And the knee tractioning stretches the joint back and forth. It's knee decompression. And that knee decompression will help to mobilize the joint, open the joint, let it move better so that you can get more function, more able to bend and kneel, get up and down off of your knees. How many people are struggling even just to get off their knees? They know if they get on the floor, they're not getting back up. That happens to some people. I wanted to prevent that from happening. I found out all the therapies that went with it, how it works. I did the therapy and now my knees are great. So we get great results with what we do. As a matter of fact, I had a lady in, she just started not too long ago, and she had both knees were really bad. Like she had bad knee pain. And I looked at her and I said, look, we have to do the exam to find out if you're too far gone. Some cases can be so far gone that they go permanent. We talked about the permanency of some of these if they're not healed properly. If they heal wrong, they'll turn into some permanency. Well, I told her, I said, there's an exam that will find out, is it already permanent? In which case, see about surgery or some other therapy that my methods wouldn't work. Well, if you're over 85% damage to the nerves, I already know that it's too late. Also, part 2 of the exam is that if you're over 85% damage to the bone, it's already too late. And so I find that most people who are told that they're already too late aren't. So we always do the test. We test to see, are you a candidate or are you not a candidate? Will this method work, or do you need to go get surgery or suffer with that problem? I never want you to suffer, but if it's not something I help, I'm not going to start that process. Well, we want to make sure of that. We did the exam on her, and we found out that the nerves were within range. It said, yes, I think I can help. So based on that, I took her x-ray. When I took the x-ray, if there's still space in there, even if it's small space, I can usually get great results on there. And so I checked hers, and she had one side, the knees were down, and I said, okay, that one's good, I can help that. The left knee was good. When I checked the right knee, it was too low. I was concerned I wouldn't be able to get any results. So I was honest, and I told her, I said, look, I'm going to get great results in your left knee. Your right knee, I might not get much results in. However, since you're getting the left knee done, I'll go ahead and treat the right knee, and we'll just see what happens. See if we can get some good results. She agreed. She thought it was a great idea. She wanted to do anything to avoid surgery. How many can agree with that? And so we started the therapy. Within just a matter of a few weeks, she's already telling me she has virtually no pain. It's like 80, 90% better already. And she's only been under care for a short time. Normally it takes longer than that. And so now, instead of stopping at that point, at the inflammation phase when she felt better, we're going through repair phase now. Right now, she's in repair phase. She's working on decreasing her sensitivity. She's working on decreasing her nerve entanglement so that she can heal properly with no permanent damage. I think that's one of the best things that I could hear about for knees. I went through the process myself. I wanted to make sure I had great knees. I wanted to get older, I have great knees. And if you have an injury and it heals wrong, you're not going to have great knees. That's going to cause problems for the rest of your life. So I'm going to recommend that you come down and get the exam done. Just see if you're able to be helped, because we have helped so many people. We have great results as long as they have less than 85% damage. So because of that, we've been doing a new patient special, and it's our $47 new patient special. Basically what it is where we do the knee pain severity exam to determine, are you a candidate for this type of care? And if you look like you are, we go ahead and take the x-ray to make sure it's not too far gone. A lot of people who told me, oh, I'm bone on bone, it's already too late, there's nothing I can do. I'll do the x-ray and they've got plenty of space. So I'm just going to say, look at it for yourself, see for yourself. When we take the x-ray, you'll be able to see it. And if you're less than 85% nerve damage and less than 85% bone damage, there's a good chance that you're going to get help naturally and without drugs, without surgery. And so we do a combination of a couple different therapies, knee decompression with laser, spinal adjusting, and some other therapies that we do that are kind of our secret sauce, so to speak. So I'll tell you about those when you come in the office, that will absolutely make a change in your body to be able to get you the help that you need if you're below the 85%. So I'm going to recommend you come in, get checked, see if you have less than 85% damage. And if you do, I'd love to help you. And if you don't, then I'll tell you that, and that way you know what you're looking at for the future. So call the office at 724-342-2225 to find out more about our knee pain severity exam. Call today, 724-342-2225.